Hello everyone. Exactly 3 weeks ago, Nature Medicine published this very important article that's relevant to our discussion today. It's a mixed method systematic review that analyzed 95 studies of arts programs / practices activities that addressing non-communicable disease risk factors across 27 countries, and the findings suggest that arts may support non-communicable disease prevention and health promotion by generating cultural relevance, providing opportunities for increased physical activity and social connectedness, by helping to identify and address systemic, structural, and social forces contributing to health disparities and inequities. It's in a way a landmark study because up until then we were only talking about arts in managing the existing symptoms, but this is about prevention. Another very important study from June 2025, which is like a few months ago, very relevant to our discussion. Music as an implementation strategy for evidence-based health interventions in Africa, a systematic review using REAIM framework. And this systematic review highlights music as a novel, non-invasive, and culturally adaptable implementation strategy for promoting health in Africa. Underscores the potential of music to bridge health equity gaps by leveraging its cultural significance to enhance engagement and intervention uptake. The review highlights the integration of health sciences, implementation science, and arts promoting interdisciplinary strategies to tackle public health issues. Now, we were talking about music and arts, but I would like to start this conversation by distinguishing the definition between these terms, music, music therapy, and music medicine. I've been discussing this yesterday and day before yesterday, but I would love to talk about it right now and clarify one last time. These are individual, separate terms with a definition of its own, and it cannot be used interchangeably. Music therapy, as defined by the American Music Therapy Association, AMTA, is the clinical and evidence-based use, meaning evidence has to come through research, meticulously planned research. Use of music requires individualized goals. It's not one size fits all. Achieved within a therapeutic relationship, right? And must be delivered by a credentialed professional who has completed an approved music therapy program. The major challenge here is that in countries except US, UK, Canada, Australia, which is all of us, India, Africa, China, Japan, all of us, many of the European countries like Sweden, Belgium, all of us, we do not have an accredited music therapy program. Accreditation meaning National Medical Commission accreditation. We don't have that, but yes. So we cannot call the music-based intervention research or any kind of music-based intervention that we use in our hospitals as music therapy. But how we can use that, I'll tell you in a bit. Music medicine is a term used when music is provided to a patient. Music, not music therapy. A normal music that's available in public domain, YouTube or anywhere else, or a musician is singing. All of those music is provided by a healthcare provider, which is doctor, nurse, social worker, anyone, to a patient without having a therapeutic relationship, just having an intention, like a health promoting goal, but not within a therapeutic relationship. That is music medicine. Now, music-based intervention is an umbrella term that you can use for anywhere else, a generalized term. Now, why do you have to have a separate course in music therapy or a national medical accredited course, formal professional service Why do you need that? Because it might seem a little frivolous. Oh my God, it's just music. Why don't you have like, you know, just listen to music and can we all call that music therapy? No, because music could be harmful at certain situations, and one is the volume control. In many researchers, you know, in some researchers, the challenges when they discuss the article and challenges, they would say, you know, the volume control and the decibel levels, that was one of the. It cannot be one size fit for all, right? And the other one is music can be associated with very strong memories, and music evoked autobiographic memories, we call it MEAM, and emotional reactions. Some people may be distressed by exposure to specific pieces and types of music. I have explained this in the last 2 days, so it's innately you know, intertwined with these memories, so it's very important that the auditory experiences has to be very customized. You have to take history from the patients and all of that. And again, music-based interventions would not just be listening to music, but far beyond that, so many activities like lyrical exploration or songwriting or instrument playing. So when it comes to playing an instrument, if somebody is playing it for a longer time, so imagine if you are using it without training, maybe perhaps in a stroke rehabilitation setting in your hospital, and they are undergoing their physiotherapy, and in between you are providing them a guitar and, you know, let's try if music has an impact. So these are all those nuances where you have to be very careful and mindful about, and that is why we need a trained expert here. And yes, and music therapy is one of the several arms of integrative medicine. We have all been, you know, talking about this since last couple of days. Integrative medicine is an approach to medical care that recognizes the benefit of combining conventional/standard therapies such as drugs and surgery with complementary therapies that have been shown to be safe and effective. That safety and efficacy has to come from randomized control trials or meta-analysis of RCTs. Now, this is very important, combining. You do not use integrative medicine approaches, including music therapy, as a standalone or a curative therapy. At least we don't have evidence for it right now. That is why we call it complementary, right? Complementary to a primary/standard therapy or treatment or management. And integrative medicine tries to address the physical, emotional, social, spiritual, and environmental factors that can affect a person's health and well-being. In the countries that have already instituted music therapy training programs and music therapists, they do have evidences on the positive impact of music-based interventions on various clinical populations. Those are post-operative pain, fibromyalgia, quality of life of patients in various disciplines of medicine, cardiology, oncology, palliative care, hospice, orthopedic settings, and then anxiety, depression, stroke rehabilitation. We have discussed about this in length and breadth in the last 2 days. Particularly, music therapy could be effective in post-stroke aphasia, the physical status, all of that, the gait. Then autism spectrum disorders, multiple sclerosis, cognitive impairment and dementia, Parkinson's, preterm infants. We have discussed about ocean disk in the last couple of days, a wonderful intervention to comfort the preterm infants who are just recently admitted to the NICU, far from the environment they knew, which is the womb of the mother. Schizophrenia, stress. Very simply, how music, any musical auditory sensation, how that's interpreted. External ear, middle ear, all of us are trained and fairly aware of how this works, like external ear, middle ear, inner ear, auditory nerve. and then when it reaches the primary auditory cortex, the primary analysis and perception happens there, and the different domains of music, which is visual, the rhythm, the melody, the emotions, all of them are interpreted in different areas of the brain, and that's particularly helpful when it comes to stroke rehabilitation. And music also reduces stress hormones, it has cortisol, and relaxing music would reduce cardiovascular or influence or modulate cardiovascular response, such as heart rate, blood pressure, respiratory rate. On the other hand, if you're listening to any kind of music that triggers you or reminds you of a specific unfavorable memory, or not so pleasing memory, or any music that excites you, like rock music or all of that, I think all of these responses, cortisol and the cardiovascular responses, they shoot up. This is a very recent, again, like 2025 June study. Music's impact on pain. These are all various. Music's impact on pain has been. There have been like 3 or 4 hypotheses in the last 2022 to 2025, in 3 years. This is the latest one, which says that music evokes pleasure, activates a range of brain structures that are also implicated in pain. Previously, there was a MICE study that discussed, there might be different corticothalamic tracts, and that could be the reason why music has a positive impact on pain. But then now it's of a different discussion, and this is very interesting, and this is also very important for us to understand that we still do not know in its entirety how music is impacting the hormones, the neurochemistry, or the pathways in brain. We are still learning, we are still understanding through animal studies and other models. Why do we actually do research in local Tanzanian music? Because the US or the UK or Canada, Australia, they're already doing such amazing work with the NIH fund or NHS fund or all of this fund. Like, why do we have to do it, right? So if you look at the map, all the purple and pinks are the countries where the research is coming from. And the challenge here is the music is focused on Western classical music. We do not have, there is a paucity of literature in the local music or global music, what you call, that would be classical Indian music, 5-element Chinese music, Sufi music from the Middle East, African, Tanzanian music, or music from Zanzibar, or the folk music, all of that, like all the white that you can see, which is all of us. We do not have any kind of music-based or very limited music-based intervention research going on. So yes, this map is very important, and it just laughing at, yeah. We have to. So I think this map should be something to inspire us to conduct more research in our own music. So I'm doing something like that in India, and we started it like earlier this year with Carnatic music. And the Indian Council of Medical Research was also very interested in conducting more research, RCTs on local music. So yeah, that's a welcoming change. Again, why do we have to do a randomized controlled trial instead of some other study? And like in the last a couple of days we were having this discussion. Maybe we can still start with an observational study, which is very simple and feasible, and then just see how if we are able to identify any positive impact or measurable positive impact that's statistically significant, and then we can advance to a randomized control trial or a quasi-experimental pre-test post-test design. Now, currently, we cannot use the term music therapy in all the countries that we saw on the map with white color, which is all of us, India, Africa, China, Japan, all of us. But when we are doing an observational study or an RCT, the music, if we are providing Tanzanian music or Carnatic music, what should all of us call it? It should be music medicine, like South Indian classical music medicine in palliative care setting. So that should be the title, and we cannot use, unfortunately, the term music therapy Yeah, but there was this beautiful study from 2010. I had no idea this existed. Only very recently, just before coming here, I came across this paper. This is a survey of healthcare practitioners in Tanzania, and the questionnaire and the survey was about their understanding about music therapy in the context of palliative care. Very interesting, and their responses is the respondents were sensitive to the needs of the patient, varied to situations in which music might be harmful, and conscious that music must be of an appropriate type. This is beautiful that this kind of awareness is there in the healthcare in Tanzania. That's beautiful, and Tanzania. I mean, you know much better than me. Tanzania, just like India or Middle East or other parts of Asia, it's musically so rich. The musical heritage is so rich. The same with the musical instruments. The repertoire is too vast. Now, Sustainable Development Goals by the United Nations, goal number 3, which is good health and well-being. Here, there was this note by SDG. It was like active, direct, and intentional music use improves health and well-being. I didn't say that. They said it, right? It's not my opinion. It's the SDG goals, that interpretation booklets. They said that. So developing international policies to promote, mandate, and utilize the power of music, right? Yes. So yes, music and society policies worldwide should be there. Music programs in all senior and care facilities, partnerships with insurers and phone providers. I think that was an interesting idea. Yeah. In NHS, again, this is one point I have been discussing in the last 2 days with the social prescribing and music prescriptions. I think one of the doctors, the suggestion is 2 hours of music per week. This is not music therapy, this is music. Listening and engaging with music, 2 hours per week. There are some, like if you come up with, I'm going to discuss about that, if you come up with an activity, I think this is how you implement that in a clinical setting or a community. You come up with a plan with a team of people, social workers and doctors and nurses, and then just see and check it out if that plan works, and then amend the plan, and and just go. Now these are some community activities I thought and I researched and came up with. Some of them are group singing, group percussion, drumming, clap, rhythm exercises, music making. It will give a sense of community, and not just for the creativity engagement. Attending live music events, songwriting, music storytelling, listening to music, right? That's simple. Chanting and breathing with music, peer duets, and with cognitive engagement, perhaps some conducting singing competitions, mini talent shows within the healthcare setups. Because maybe some of these you never know, might encourage patients to visit the clinic or the hospital. Sing-along sessions, music journaling, and action songs perhaps. You never know what works, so that's why you have to keep amending the plan. Come up with a plan, implement it, and then you just figure it out as you go. For older adults, maybe a seated dance / some amount of movement to music, music-guided stretching, games with music, maybe give like thematic days like songs from childhood on Wednesday or traditional Tanzanian folk music on Saturday, right? And maybe develop listening clubs among your patients, play recordings of familiar or local music or discuss memories or feelings, music-based home visits, yeah, that could be done. And then the last one is how to encourage patients. This is something that came up at the top of my mind. I hope this would encourage you to think more because you know the community better up close. Music in waiting areas perhaps, or short music visits like perhaps like 5 to 10 minutes of session music to build comfort and then gradually add a simple health screening, link health tasks to music. So for example, after we sing your favorite song, we can check your blood pressure quickly or something like that. These are something that I came up with top of my mind. But I hope this encourages you to think more ideas. This is very important. I cannot stop, I cannot just leave without mentioning about this, because at the end of all my Indian talks, I talk about this, the policy considerations. In World Health Organization's Health Evidence Network Synthesis Report 67, November 2019, they had entire booklet of a lot of analysis and interpretations and reviews, and what these policy considerations are in alignment with WHO's Report 67, which is to facilitate RCTs on the local music, through dedicated research institutes as well as government-funded long-term research grants focused on large clinical populations where there's already substantial evidence base. That's what I had shown initially, all the circles, right? The pain, Parkinson, and all of that. All those are clinical avenues where already research has been conducted. So yes, we can start from there and then facilitate RCTs exploring the feasibility, acceptability, and suitability of clinical inculcation. Constitute a multidisciplinary panel comprising physicians, musicians, and physician-musicians as a bridge to formulate a policy framework aimed at developing music therapy training programs across Tanzania that train students in delivering the music therapy, and that is proven through RCTs. Institute procedures for music therapy board certification / accreditation. Establish RCT training workshops for researchers. Yesterday we did 2 of it. That is an introduction, tip of an iceberg, right? So multiple such workshops need to be conducted. Then advocacy programs within healthcare settings to promote recognition of music-based interventions, which I am doing in India and also in a way internationally as well, which is called as Oncology and Strings. I started that in 2019. Then promoting public awareness of the benefits of music-based intervention while actively stopping misinformation that exaggerates their effects. That's very, very important, because after the democratization of social media, like internet and access to internet and data, I think there are so many websites that would say music curing cancer. If you just type my name on Google, you can see one article saying Kerala doctor, Indian doctor curing cancer with Carnatic music. I wrote to the editor and journalist to say that, oh my God, I think you totally misconstrued what I said. I never said music will cure anything. At least we don't have evidence right now. Music, what it does is, as an adjunct, it would improve some of the symptoms. So there are so much of misinformation around, so we should also take an active effort to stop that. So recapitulating what I just said, 2 important points, that's all. 2 challenges. One is lack of high quality evidence on Tanzanian music among Tanzanian patients. Now the solution for that is research workshops for doctors and researchers. The second one is design randomized RCTs in Tanzanian music-based interventions. The second challenge is absence of national medical regulatory body accredited academic music therapy training programs in Tanzania. So the solution is greater implementation efforts are required in forming a professional organization for music therapy, so to set guidelines for a culturally appropriate training curriculum. The second, guidelines for regulations and credentialing procedures for providers. Thanks so much. It's such an honor to be here and talking about this. It's very lovely.
Thank you so much. Let's put our hands together for Dr. Tara. Thank you so much, Doctor, for a very insightful session on music as a therapy.